Welcome to the deep dive. Today, we're going to explore cholinergic agonists. You might also know them as parasympathomimetics.
As a nurse and student, you're already familiar with how important it is to keep learning about medications.
That's why we're going to really dig into how these drugs work, what they do, when they're used, and what nurses need to know about them.
We'll also talk about a drug called memantine.
It's used for Alzheimer's disease.
Right, and although it's not actually a cholinergic agonist, I think you'll find it relevant to your work.
So should we jump right in?
Let's do it. To understand cholinergic agonists, we need to start with the parasympathetic nervous system.
Okay, the parasympathetic nervous system, or PNS for short.
Exactly. It's often called the rest and digest system.
It's all about those essential functions,
Right.
right? Like digesting food, slowing our heart rate, constricting our pupils.
All of that. It's how our body chills out.
The opposite of the fight or flight response.
Precisely. Now, where does acetylcholine fit into all of this? Well, it's the primary neurotransmitter in the PNS. It's like a messenger molecule. It allows nerves to communicate with their target muscles or glands.
And how does it do that?
By binding to specific receptors, think of them like locks that acetylcholine, the key, fits into.
And this binding triggers those responses we were talking about.
Exactly. There are two main types of these cholinergic receptors, nicotinic and muscarinic receptors.
Nicotinic and muscarinic. So tell me, what's the difference between the two?
Well, nicotinic receptors, you find those mainly in ganglia. They're like relay stations between nerve cells.
Okay, ganglia, got it. And they're stimulated by...
Nicotine, as you might guess.
Dak.
The same stuff in tobacco.
Of course.
But other substances can activate them too. Now, muscarinic receptors, you find those in the effector organs themselves.
Effector organs, you mean the muscles and glands?
Yes, the ones directly carrying out the instructions from the parasympathetic nervous system.
So they're the ones actually doing the rest and digest work.
Right. And these muscarinic receptors, they're activated by a substance called muscarine.
Muscarine. Where have I heard that before?
It's found in certain mushrooms, some rather interesting ones, I might add.
Interesting is one word for them. So these receptors are the targets for cholinergic drugs, right? The whole focus of our deep dive today.
That's it. These drugs basically work by mimicking or enhancing the effects of acetylcholine.
So they're turning up the volume on the parasympathetic nervous system.
That's a great way to put it. Now, there are two ways these drugs can do that. They can be direct-acting or indirect-acting.
Okay, direct and indirect. Break that down for me.
Direct-acting cholinergic agonists, they bind directly to those receptors.
Just like acetylcholine would.
Exactly. Indirect-acting ones work a little differently. They increase the amount of acetylcholine that's hanging around
How do they do that?
by inhibiting the enzyme that breaks acetylcholine down. Acetylcholinesterase, or sometimes it's just called cholinesterase.
Inhibiting it. So they're preventing the breakdown of acetylcholine.
Exactly. That means acetylcholine sticks around longer and its effects are stronger.
Makes sense. Can you give me some specific examples of both types? Like, what are some actual direct-acting cholinergic drugs?
Sure, bifinical is one. It's often used to treat urinary retention because it helps the bladder muscles contract and, get things moving.
So it's like giving those muscles a little nudge.
Exactly. Then you've got carbachol and pilocarpine. They're used in eye drops for glaucoma.
Because they constrict the pupil.
Right, and that lowers intraocular pressure. Then there's sublimeline. It's prescribed for dry mouth, especially in a condition called Sjogren's syndrome.
Sjogren's syndrome, where you don't produce enough saliva.
Right. And then there's succinylcholine.
Cinylcholine, that's a bit of an oddball, right?
It is. Even though it's a cholinergic agonist, it's actually used as a muscle relaxant during surgery.
How does that work?
Well, it causes a short period of muscle contraction followed by paralysis. It helps with things like intubation.
So it's kind of like a controlled shutdown of the muscles. Fascinating. Now, what about indirect acting cholinergic agonists?
Oh, they have some interesting uses too, like pyridostigmine and edrophonium.
Those names ring a bell. Myasthenia gravis, right?
You got it. They're used to both diagnose and treat myasthenia gravis.
That's the condition where the communication between nerves and muscles is disrupted.
Yes. These drugs help improve muscle strength by increasing acetylcholine levels at those neuromuscular junctions.
So they're boosting the signal between nerves and muscles.
Exactly. And they can also be used to reverse the effects of some muscle relaxants used during surgery.
Interesting. So they're kind of like an antidote in that case. And you mentioned earlier that they're used for anticholinergic poisoning, too.
That's right. And let's not forget about their role in treating Alzheimer's disease.
Ah, yes. Drugs like donepezil, galantamine, and rivastigmine.
Exactly. They can help improve cognitive function in people with Alzheimer's, again, by boosting those acetylcholine levels, but this time in the brain.
So many different uses for these indirect acting agonists. Really remarkable. Now, before we move on, I do want to touch on memantine again. You mentioned it earlier.
Oh, yes, memantine. It's often used alongside those cholinesterase inhibitors we just talked about.
But it's not actually a cholinergic drug itself, right?
Right. It's important to remember that.
And it's primarily used for Alzheimer's disease, if I remember correctly.
That's right.
So if it's not working like these cholinergic drugs, how does it help with Alzheimer's?
Well, memantine operates through a completely different mechanism. It's classified as an NMDA receptor antagonist.
NMDA receptor antagonist. Okay. Break that down for me.
It means that memantine blocks the activity of a specific type of receptor in the brain, the NMDA receptor.
NMDA receptors. What do they have to do with Alzheimer's?
Well, researchers believe that overstimulation of these receptors contributes to the progression of the disease.
So memantine is protecting the brain from this overstimulation.
Precisely. By blocking those receptors, it helps protect brain cells. It may even slow down the disease process.
It's amazing how different drugs can target completely different pathways, but still be used for the same condition. So we've talked about acetylcholine, receptors, and types of drugs. Now, let's zoom in a bit. What happens at the cellular level when one of these cholinergic drugs gets to work?
Okay, so imagine a cholinergic drug arriving at a muscarinic receptor on an effector cell.
Like a muscle cell or a gland cell?
Exactly. The drug binds to the receptor, and that triggers a chain reaction.
A domino effect inside the cell.
Yes. Ultimately, it changes how permeable the cell membrane is.
Permeability. That means how easily things can pass in and out of the cell.
Right. In this case, it affects the movement of ions, things like calcium and sodium.
Those are important for all sorts of cellular processes.
Exactly. This change in ion flow then depolarizes the cell membrane.
Depolarizes, meaning it changes the electrical charge of the membrane.
Yes. And that ultimately links to a response from the effector organ.
So it's like the drug is sending a signal, and the cell is responding.
That's a great way to think about it. And remember, these effects can be quite diverse. That's because the parasympathetic nervous system affects so many different organs.
Right. I remember learning a mnemonic to help remember all those effects. SL-PELUDGE. Can you remind us what that stands for?
Of course, SLEGE stands for salivation, lacrimation, urination, diarrhea, gastrointestinal distress, and emesis.
Salivation, lacrimation. So basically all the things that happen when your rest and digest system is in overdrive.
Exactly. They might not always be pleasant, but they're all connected to those essential parasympathetic functions.
Increased salivation helps with digestion. Urination and defecation get rid of waste.
Right. Now, it's important to keep in mind that while we usually want those muscarinic effects,
The rest and digest effect.
yes, at higher doses, cholinergic drugs can start to stimulate nicotinic receptors as well.
Ah, so it's all about finding the right dose.
Exactly. We want to hit that sweet spot where we're getting the therapeutic effects from the muscarinic stimulation without too many unwanted effects from the nicotinic stimulation.
A delicate balance. Okay, so we've laid a solid foundation. We've talked about the parasympathetic nervous system, acetylcholine, receptors, the different types of drugs, and their general effects. I think it's time to move on to specific clinical indications.
I agree. Let's dive into when and why we use these cholinergic agonists.
Let's start with the direct-acting ones. We've already mentioned a few examples, but let's put them in context.
Okay, so remember bethanical.
The one that helps with urinary retention.
Right. It's often used after surgery, for example, when people have trouble urinating.
Makes sense. Their bladder muscles might be a little sluggish after an operation.
Exactly. And then we have carbachol and pilocarpine, those eye drops for glaucoma.
They lower intraocular pressure by constricting the pupil.
Right. They're essential for managing that condition. And then there's Cevimine.
For dry mouth in Sjögren's syndrome.
Precisely. And lastly, we have that unique case, succinylcholine, the muscle relaxant.
Used during surgery to help with intubation and things like that.
Right. Now let's switch gears to those indirect acting agonists.
The ones that increase acetylcholine levels by blocking the enzyme that breaks it down.
Yes. And remember, we talked about their role in diagnosing and treating myasthenia gravis.
Using drugs like pyridostigmine and edrophonium,
Exactly. They help improve muscle strength in those patients.
and they can reverse the effects of certain muscle relaxants too.
Right. And they're used for anticholinergic poisoning as well.
And let's not forget their important role in treating Alzheimer's disease.
Drugs like donepezil, galantamine, and rivastigmine.
They can make a real difference in the lives of people with Alzheimer's. Now, before we wrap up this part, I do want to circle back to memantine one more time.
Sure.
It's used for Alzheimer's, but it works differently than those cholinergic drugs.
Right. Memantine is an NMDA receptor antagonist. It blocks those receptors, protecting brain cells.
Fascinating stuff. So we have these two different approaches to managing Alzheimer's.
Exactly. And both are important tools in our arsenal.
Well, I think we've covered a lot of ground in this first part of our deep dive. We've explored the basics of cholinergic agonists and their diverse clinical applications.
We've laid the groundwork for understanding how these drugs work and why they're so important in various medical fields.
But our deep dive isn't over yet.
There's still much more to explore.
In the next part, we'll delve into the nursing considerations for these medications, including patient education, monitoring, and potential complications.
We'll also talk about evidence-based practice and how it guides our care.
So stay tuned for part 2, where we'll really dive into the practical aspects of caring for patients receiving these fascinating drugs.
We'll see you there. Now let's talk about some of the things that can go wrong when using these drugs.
Because, like all medications, cholinergic agonists come with potential risks.
Exactly. We call these unwanted effects adverse effects.
Adverse effects, basically side effects.
Right. And often they're caused by too much stimulation of the parasympathetic nervous system.
So too much rest and digest.
Precisely. Remember that SLDGE mnemonic we talked about earlier?
Salivation, lacrimation, urination, all that.
Yes. Those are all potential consequences of excessive parasympathetic activity.
It's like the body's stuck in chill mode, but it's gone too far.
You could say that. And on top of those, you can also see things like bradycardia.
Bradycardia, that's a slow heart rate.
Right. And hypotension.
Low blood pressure.
Exactly. And then there are the more general things like dizziness and headaches.
Not fun.
Yeah.
But those are all things we can monitor for, right?
Absolutely. And there's another more serious risk we need to talk about. Cholinergic crisis.
Cholinergic crisis. That sounds scary.
It can be. It basically means there's way too much acetylcholine activity going on.
And that's usually caused by...
And an overdose of cholinergic drugs.
So someone takes too much of their medication.
Right. Or sometimes it can happen if someone's exposed to certain pesticides or nerve agents.
Wow, it's serious. What are the signs of a cholinergic crisis?
Well, severe muscle weakness is a big one. And respiratory paralysis.
Respiratory paralysis. That means they can't breathe on their own.
Exactly. It's a life-threatening situation. So we need to be able to recognize those signs and act quickly.
What's the treatment for a cholinergic crisis?
Atropine.
Atropine. How does that work?
Atropine is a cholinergic antagonist. Basically, it blocks the effects of acetylcholine.
So it's like an antidote.
Exactly. It helps restore that balance and hopefully prevent a fatal outcome. Okay, so we've talked about some of the potential risks. Now, let's talk about the role nurses play in all of this.
Because nurses are the ones on the front lines, right? They're the ones interacting with patients, administering these medications, and making sure everything goes smoothly.
Absolutely. And nurses play a crucial role in patient education, too, making sure patients understand their medications, potential side effects, and what to do if something goes wrong.
So let's talk about the nursing process. How does that framework guide our care for patients receiving cholinergic agonists?
Okay, so the nursing process starts with assessment.
Gathering information about the patient.
Precisely. We need to know their medical history, any allergies, other medications they're taking.
Their lifestyle, their habits.
All of that. It helps us identify any contraindications.
Contraindications.
Yeah.
Those are situations where we shouldn't use a particular drug.
Right. For example, if a patient has a known allergy to a cholinergic agonist, we obviously wouldn't want to give it to them. We also need to get baseline vital signs, especially blood pressure.
Because these drugs can cause hypotension, right?
Exactly. And we need to educate patients about orthostatic hypotension.
That's the dizziness you can get when you stand up too quickly.
Right. We need to teach patients how to change positions slowly to minimize that risk.
Makes sense. And for specific conditions like myasthenia gravis or Alzheimer's disease, we might do additional assessments, right?
Of course. For myasthenia gravis, we'd want to assess their muscle strength, reflexes, any signs of weakness or fatigue.
And for Alzheimer's disease.
We'd focus on their cognitive function, their memory, orientation, how well they're able to function in daily life. All of this gives us a baseline so we can track their progress and spot any problems early on.
Okay, so we've done our assessment. What's next?
Planning. We use the information we've gathered to create a personalized care plan.
A roadmap for their care.
Exactly. We set goals and we figure out what interventions will help us achieve those goals.
Can you give me an example? Like, let's say we have a patient who's receiving bethanechol after surgery because they're having trouble urinating.
Okay, so our goal might be for them to void a certain amount of urine within a specific time frame after receiving the medication.
Makes sense.
Yeah.
And what kind of interventions would we put in place?
Well, we'd want to monitor their urine output, of course, and encourage them to drink plenty of fluids.
Help them get to the bathroom if they need assistance.
Exactly. And of course, we'd want to educate them about the medication, what it does, potential side effects, things like that.
Empowering them to be active participants in their care.
Precisely. And for a patient with myasthenia gravis who's taking pyridostigmine, our goal might be to improve their ability to do everyday activities without getting too tired.
So focusing on their quality of life.
Yes. And our interventions might include things like teaching them energy conservation techniques, or scheduling activities for when the medication is at its peak effectiveness, maybe even considering adaptive equipment if necessary.
And for a patient with Alzheimer's disease who's taking Dunpizel.
Our goals might focus on maintaining their cognitive function for as long as possible, keeping them safe, supporting their caregivers.
A complex condition like Alzheimer's requires a multifaceted approach.
Absolutely. Our interventions might include things like structured activities, simplifying their environment, and connecting their family with support resources.
Planning is all about being proactive and anticipating potential challenges.
Right. It's about working together with the patient, their family, and the whole healthcare team to come up with the best possible plan.
Okay, so we've assessed, we've planned, now what?
Now we implement.
We put that plan into action.
Exactly. This is where our nursing skills and knowledge really come into play.
So what does implementation look like for patients receiving cholinergic agonists?
Well, first and foremost, we have medication administration.
Making sure they get the right drug, the right dose, at the right time.
And by the right route. And we need to watch for any immediate adverse effects.
Like an allergic reaction.
Right. Or anything else that seems unusual. We also need to be on the lookout for delayed or less obvious side effects.
Things that might not show up right away.
Exactly, like that orthostatic hypotension we talked about earlier.
Yeah.
Or gastrointestinal upset. Or any changes in their mental status.
So we need to monitor their vital signs regularly.
Yes, and observe their behavior carefully. Talk to them. Ask them how they're feeling. Encourage them to speak up if anything seems off.
Open communication is key.
Absolutely. And then there's patient education.
Making sure they understand their medication, the potential benefits and risks.
Right. And any precautions they need to take. For example, dry mouth is a common side effect of these drugs.
So we might suggest sugar-free candy, or gum, or frequent sips of water.
Exactly. Or artificial saliva products. And constipation can also be a problem. So we might encourage them to eat high-fiber foods and drink plenty of fluids.
And remind them about fall risks, especially if they're experiencing dizziness.
Right. We want to keep them safe. And for patients with Alzheimer's disease, education might focus on safety measures in the home, communication strategies for caregivers, and available support resources.
It's all about giving them the tools and information they need to manage their condition.
Exactly. Implementation is where the rubber meets the road. It's where we put that carefully crafted plan into action.
And hopefully see positive results.
Mhm.
But our work doesn't stop there.
Right. The final step in the nursing process is evaluation.
We need to assess whether our interventions are working.
Exactly. Are we meeting those goals we set? Is the patient improving? Do we need to adjust the care plan?
So for our patient who received bethanechol for urinary retention, we check whether they were able to void successfully.
Right. And if not, we'd need to figure out why and maybe adjust the dose or try a different medication.
And for the patient with myasthenia gravis who's taking pyridostigmine, we'd want to see if their muscle strength and endurance have improved.
Exactly. Can they do more activities without getting fatigued? And for the patient with Alzheimer's who's taking Dunpizel, we'd be looking at their cognitive function, mood, overall well-being.
Looking for any signs of improvement or decline.
Exactly. Evaluation is an ongoing process. It's not a one-time thing. We're constantly reassessing and adjusting as needed.
Making sure the care plan is still relevant and effective.
Right. It's about being flexible and responsive to the patient's needs. And it's also an opportunity to reflect on our own practice. What worked well? What could we do better next time?
Continuous improvement. Now, speaking of improvement, you mentioned evidence-based practice earlier.
Yes. Evidence-based practice is crucial in nursing.
It's about using the best available research to guide our decisions.
Exactly. We don't just do things because that's how it's always been done. We look at the research. We see what works. And we apply that knowledge to our practice.
But it's not just about the research, right?
Right. It's also about our clinical expertise and the patient's values and preferences.
So it's a three-legged stool: research, expertise, and patient-centered care.
Exactly. And when it comes to cholinergic agonists, there's a lot of research out there to guide us.
Research on dosages, timing, different interventions.
Right. For example, there are studies looking at the optimal time to give cholinesterase inhibitors to patients with Alzheimer's disease.
To maximize their effectiveness.
Exactly. And there's research on non-pharmacological interventions, too. Things like exercise programs and cognitive stimulation therapy.
So it's not just about the drugs. It's about a holistic approach to care.
Absolutely. And as nurses, we have a responsibility to stay up to date on the latest research.
To keep learning and growing.
Exactly. That's how we ensure we're providing the best possible care to our patients. Okay, so we've covered a lot in this part. We talked about potential risks, the nursing process, and evidence-based practice.
A lot of practical information for nurses caring for patients receiving cholinergic agonists.
But our deep dive isn't over yet. There's still more to explore.
Welcome back to the deep dive. In the last two parts, we went deep into cholinergic agonists, how they work, and their uses in nursing. Now, we'll look at specific considerations for different groups of patients and the ethics of using these drugs.
And of course, we'll talk about what the future might hold for cholinergic agonists.
Sounds good. Let's get started. One thing we always need to remember is that every patient is unique.
Right. Patient-centered care is crucial.
It's about providing care that's safe and effective, but also compassionate and respectful of each patient's values and cultural background.
Absolutely. So, with that in mind, let's talk about older adults. They often need special consideration when it comes to medications.
Because their bodies might process drugs differently than younger people do.
Exactly. Older adults might be more sensitive to the effects of cholinergic agonists. That's because their metabolism and organ function can change with age.
So those side effects we talked about before, the dizziness, the gastrointestinal issues, those could be more pronounced in older patients.
Right. And we also need to remember that many older adults have multiple chronic conditions.
And they might be taking several medications already.
Exactly. So there's a higher risk of drug interactions.
So careful medication reconciliation is essential.
Absolutely. We need to know everything they're taking, prescription and over-the-counter.
To avoid any nasty surprises.
Right. And we need to monitor them closely, too, looking for any changes in their condition or how they're responding to the medication.
And adjust doses as needed. Now, what about children? How does caring for pediatric patients who need cholinergic agonists differ from caring for adults?
Well, kids are still growing and developing, so their bodies handle medications differently.
Right, their systems aren't fully mature yet.
Exactly. We can't just give them the same dose as an adult. We have to calculate it based on their weight.
To make sure it's safe and effective.
Right. And clear communication with parents or caregivers is even more important when we're talking about children.
Because they're the ones who will be administering the medication at home.
Exactly. We need to explain everything clearly, answer their questions, address their concerns.
So they feel confident and empowered. Now, let's talk about cultural sensitivity. How does a patient's cultural background influence their care?
Cultural sensitivity is so important. Different cultures have different beliefs about health and illness.
And different ways of communicating.
Right. Some cultures might have traditional remedies they prefer to use. Others might have certain dietary practices that could interact with medications.
So we need to be aware of those cultural factors and incorporate them into our care plan.
Exactly. It's about respecting the patient's beliefs and values. It helps build trust and rapport.
And ultimately leads to better outcomes. Now, let's touch on some of the ethical considerations that can arise when using cholinergic agonists.
Especially in situations where we're dealing with complex conditions like Alzheimer's disease.
Right. These medications can raise some tough questions.
Like informed consent, for example. As Alzheimer's progresses, a person might lose the ability to make decisions about their own care.
So how do we ensure they're still getting the best possible care?
That's where surrogate decision makers come in. Usually it's a family member.
And the nurse plays a vital role in advocating for the patient's best interests.
Absolutely. We need to make sure decisions are aligned with what the patient would have wanted.
Or, if we don't know their wishes,
Yeah,
what's truly in their best interests. It can be a challenging situation.
it can be. And sometimes seeking guidance from an ethics committee can be helpful. It's important to have those open discussions and make sure we're providing ethical and compassionate care. Now, let's look ahead. What does the future hold for cholinergic agonists?
What's on the horizon in terms of research and development?
Well, researchers are always looking for new and better treatments. One area of focus is developing drugs that are more selective.
Selective in what way?
Right now, some cholinergic agonists affect both muscarinic and nicotinic receptors. Researchers are trying to develop drugs that only target specific subtypes of receptors.
So we can get the desired effects without the unwanted side effect,
Exactly. And they're also looking at new ways to deliver these medications.
like different formulations.
Yes, things like transdermal patches or implants.
That could provide a more steady and controlled release of the drug.
Right. It could also improve patient adherence. If they don't have to remember to take a pill every day, they're more likely to stick with the treatment. And of course, there's a lot of ongoing research into Alzheimer's disease.
The search for a cure continues.
It does. And while we don't have a cure yet, there's reason to be optimistic. Scientists are making progress in understanding the disease and developing potential treatments.
It's an exciting time to be in healthcare. So much is happening. So much is changing. As we wrap up this deep dive, I want to leave our listeners with a question to think about. Given the rising number of people with Alzheimer's disease, what role do you see nurses playing in early detection and support for patients and families?
What a great question to end on. It really highlights how important nurses are in the care of people with Alzheimer's.
We're often the first point of contact for patients and families.
Right. We can educate people about the disease, the warning signs, the importance of early diagnosis.
And we can provide emotional support and guidance to families who are struggling to cope.
Absolutely. We can help them navigate the healthcare system, connect them with resources, advocate for their needs.
And as the disease progresses, we can provide compassionate care, focusing on comfort and quality of life.
Exactly. It's a challenging but incredibly rewarding role. Well, this has been a fascinating deep dive. We've covered a lot of ground, but there's always more to learn.
That's the beauty of nursing, isn't it? It's a lifelong journey of learning and discovery.
It is.
Yeah.
So stay curious, stay engaged, and keep striving to provide the best possible care to your patients.
And thank you for joining us on the deep dive.